Right, Matt, are you ready for episode number 2?
I am ready, Pam. I am ready. Let's go. Say, I have a question for you.
What's
We've
that?
talked about this before, and I want your opinion on it. I've made the statement that dentistry has failed the public, especially for people with TMD. And now that you are in the dental schools and you're in the teaching environment, tell me what's going on.
Well, that is a saucy subject from my saucy colleague. Let me start because this might resonate with our listeners. Okay. And I know it's going to resonate with you, Mac. Um, when we've been treating TMD as long as we have, a lot of you listeners, you probably have seen, I don't know, anywhere from 4 to 6, 10 different doctors before you found me or Mac or people who treat patients like we do for TMJ issues. And it's failed, dentistry and medicine's failed the public because we wish you didn't have to go through all that suffering, all that expense. When people are having pain, vertigo, ear issues, eye issues, they get to us to a point where they are frantic, they're depressed, and typically medicated. A lot of times, I mean, Mac, they think that they're crazy. I hate that word. And they think that they have some kind of undiagnosed tumor. A lot of times their relationships are falling apart. The whole world's, their careers is falling apart because they live with debilitating pain. And quite often you see it in their eyes. You see
Oh,
that they're on the point of suicide. That's heartbreaking. 20 plus years doing this, I can't help but feel for each one of these people.
well, it
And
is hard. It is heartbreaking, Pam, and especially you've already mentioned like tumors. So people don't know about this pain. You know, if you break your leg, you set it in a cast, it heals. Everybody knows you're going to be okay. But you have this pain, and it's always going on. Your spouse doesn't understand it. Your loved ones don't understand it. You're misunderstood by everybody,
so
and you're
true.
sent to a neurologist, and the neurologist says, "I don't know of anything wrong. Let's do an MRI." That scares the living life out of you, and then you're waiting for the report, and you know it's going to be bad, and then you go, and the neurologist says, "I got your report back. You're perfectly fine. There's nothing wrong with you." And
Right.
then they get kicked down the road once
Right.
again.
So, like just this week, I finished with this one patient. Her name was Emily. She's now in her early 40s. And she saw me, she found me just pre-COVID. And she came to me, because we still do general dentistry too. But she came to me because she keeps breaking the bonding off of her upper front tooth, right? And her doctor said, okay, I don't know what to do. I'm not a cosmetic dentist. Go find one. So she came to me for a broken front tooth. And, when we look at her bite and her posture and we look at her intake and she's got all these things checked off. She's giving her shots, gets herself shots every day for vertigo. She's trying to do yoga, but she can't even do yoga to feel well. On all these other neurological medications to suppress what her body's feedback is telling her, and of course on antidepressants. And so she comes to me with the broken front tooth, and we have to show her that, yeah, we can fix that broken front tooth, but you're going to break it again because your teeth don't fit together right, which is creating this imbalance in the face, which is connected to your head, your neck, your entire body. And when our body is not in balance, it can cause a myriad of issues, right? So fast forward, because COVID happened and everything, we made her, after I fixed the bonding, we made her an orthotic, like you and I did. It was a neuromuscular. There are different types of orthotics, as we'll get into in further podcasts. But this one was about, with her symptoms, where can we balance her bite, her body, to start calming down all the other symptoms? And I told her literally in 1 month, if we can get you feeling 80% better, like get your quality of life 80% better. And a lot of times medical says 20% is a success. I'm shooting for 80 because this is a
Absolutely.
big deal. This is somebody's life we're dealing with. So we made her an orthotic, and she comes back to me the next month. She's like, I cannot believe this. Like, how is it? Like, she's in tears that I've seen all these doctors, and I think I'm crazy. And how is it that this little thing made me feel so much better? And it's just, as you know, as well as I, it's about physiologic balance and getting things functioning correctly. So, she finished treatment and hers because she has great natural teeth. She even had wisdom teeth. Not, she couldn't make it any harder for me. She was an orthodontic case and she just finished like yesterday. And I was like, hey, Emily, she actually said, hey, do you know why I came in here? And I remember all my patient stories. These are big deals, right? And I was like, I do. Is your front too? She's like, yeah. And she goes, I can't believe that I've lived this long with so much pain. It's just, and she paused. I was going to say debilitating, but I didn't want to feed words. And she's like, it's debilitating. And nobody knows what I'm going through. And my husband thinks I'm crazy and I can't take care of my kids and go to work. And all it was is I just needed better balance with my bite that triggered everything else. And that I know your frustration, and I do feel like dentistry's failed the public, medicine's failed the public, because when we're in the schools, we're just so nearsighted about what we're teaching, right? And learning.
Well, that is an incredible story. And just think, Pam, if you had not been trained on how the parts and the participation of the lower jaw to the upper jaw and how the teeth, if you had not been trained in knowing that the reason that that cosmetic procedure failed, she'd still be in misery.
Yep.
And I mean, that is a very, very complicated thing for dentists to understand. And how you're going to be teaching, how do you teach something so complicated? Well, it has to be taught. These people have to be listening to us. They have to be taken care of. They have to be taken out of pain.
Mhm.
And here's a person that came to you for cosmetic reasons and ended up changing her life.
Right.
What a fantastic story. And how does that make you feel? Is a treatment.
And I
Yeah,
get a little emotional. I mean,
yeah.
it's hugs and tears and trying to keep it together because we don't want to see people suffer this way. And, going back to the dental school question you asked me is I do teach in the dental school. I teach in the clinical floor and it's doing general dentistry, but I see the gap and I understand it because 4 years is not enough. Believe it or
Yeah.
not, 4 years is not enough to understand like a holistic global approach to wellness. Not in dentistry and not in medicine. It's just a lot of education, and people have to have the passion um, to want to know more because it's countless hours of education and cost and equipment. Aside from that, you have to know where to learn these things. And then when you start treating it, Mac, the way we treat people is not common knowledge. And so a lot of ENTs and neurologists and even our dental colleagues, they have no clue what we're doing. And they think this is, some kind of snake oil or tonic when it's
Right.
just about creating balance. Our body yearns for balance in every way. And when we compensate our posture or our function, it's just a matter of time before that cup that's been filling over time just spills and then people start to fall apart, and dysfunction can happen early on and it can happen much later in life, right?
And because it's a pain not associated with a tooth, then people seek medical care.
Right, right.
And because it's medical care and medicine and dentistry over time have separated the mouth from the body, which is the most asinine thing in the world to do because we're all connected. If you want to open up, I mean, that's asinine.
It is asinine.
Because we are connected. And so you have an ear pain, you go to an ENT, you got a headache, you go to a neurologist.
Yeah.
Ear pain we talked about in the first episode is because that joint is being pressed back to up against the ear canal. It just makes common sense. Put your
Yes.
finger up there in front of your ear and move your joint. You can feel it move. If it moves too far back, it's pinching a nerve, pinching a nerve. So and if you have muscles that are sore and you can push on the sore, that's a trigger point. That's a muscle issue. That is a dental issue. That is not a medical issue. And we have to be able to, well, not we, the medical profession has to become aware of TMD the same as the general dentists have to become aware of TMD.
I think the otolaryngologists, the ear, nose, and throat doctors in my area, in the DC area, are starting to grasp that a little bit, because when the patient keeps going back with the same complaints and they've looked at them inside out, then finally they're like, maybe it's your TMJ. Find a TMJ dentist. And good luck with that, because they're going to
Yeah,
go to most dentists with our former training. That'll make them a night guard,
yeah.
which, once upon a time I did that, and it's fine for helping nocturnal bruxism or grinding, but it can actually make the joint and all those issues so much
Worse.
worse, which then makes people feel even more hopeless. Um,
And the word splint, if you use that word, some patient said, "You're going to break my jaw," so
there's them to death,
it's
right?
everything about TMD is confusing, and it needs to be unconfused. And so that's our job. That's what we're
Yep,
this
that's what we're
podcast is
going to
all about.
do. A lot of people also come in thinking like we can just do joint replacements of the TMJ, that quite often is extremely ineffective. And as we open up this discussion in each podcast, we're going to actually narrow it down into very specific topics, so it's digestible and easy to understand for people who are suffering. Because this is mine and yours passion project, is just to put good content, because we can't touch enough people, right? So this is what this platform is for, is to get people to open up how on what they see and with their dysfunction, and the right questions to ask their doctors. Um, but the concept that you're talking about, early medicine being so fragmented, there's not that global understanding. The way we do it in our office and the way you used to do it is that we don't see a high volume of patients anyway, because this takes time to sit down and listen to someone's story, and to take the intake on, like doing a CBCT, which is that 3D scan of the head and the neck, looking at their joint, looking at their face, looking at their airway, using electromyography, which measures the muscles that open and close our mouth, which are, anywhere you touch your face, all of those are muscles that make your jaw work. But if we don't have the time, if you have a business model where you're seeing a ton of patients, you don't have the time to listen to their story. You don't have the time to, do the correct intake to make the right diagnosis. So it's really easy for things to go missed, because there's just not the time and too much volume, you know?
Yes, and so that's going to lead into, and I want to do this. I have one more thing to say to the listeners. If you have ear pain and you go to an ENT and your ears are perfectly fine,
Yep.
then ask the ENT, could it be my joint? Could it be my TMD? Put the pressure on them. Now, here's the sad part. They don't know anything or may not know anything about TMJ. In your area, they're starting to learn. But they will say, if it is your TMJ, then go see your dentist. Well, their dentist is not qualified to treat them because they haven't been trained. They're just as
Right.
unaware as the physician is. So ask the physician, please send me to somebody that is TMD trained and help me. We've all got to work together on this. We can't
Right.
just say, you just need to see your dentist and shut the door and kick them down the road.
Right.
Now, the business model, and I'm just going to open the door if we're really opening up and say the word insurance.
Mm,
And
that's so true.
will my insurance pay for it? And I've said before, in 1972, I was paid $1,000 to $1,500. People with their insurance paid. It's the same today. It hadn't changed. So the business model is see more, see more, see more, see more. Only do what the insurance pays for. That's not going to cut it. Just
That's
not going to cut it.
true. People are sadly being treated by numbers and codes, and not to their pain and their story. Definitely not uniquely to what their needs are. And that's a really good point. Absolutely. So, as we wrap it up, let's help people figure out how, what do they do? Where do they get started? Like, how do I find the right person then, right? And one of my questions I want you guys to ask yourself is, and you need to sit down and think through this before you start searching for the right doctor, dentist to help you, is, do you want to actually fix the problem? Because it can be expensive for you and it can be a little bit arduous, but it is fixable. You can have a great quality of life again. Or sometimes if you're at a massive transitional time in your life, new career, moving, pregnant, divorce, whatever, is you might not be ready to fix the problem, and you might just do like things to help treat it therapeutically. Some people do injectables like Botox, where they seek physical therapy or massage therapy. These are things that are helpful, but you got to understand this is a degenerative condition and things will continue to get worse, but it's okay if right now that's all you really can afford or have time to do. And then the other thing I want you to think about is if you suffer, well, quite likely if you have children, they probably have the same structural face type, or they might also have the same allergy or issues that you did, or tongue issues that help develop our face and our joint. So, how can you prevent or negate this happening in your own children so they don't have to suffer the same way you did, right?
100%. And so, what I did is I treated people with TMD. And what you are doing is what's so impressive is you are preventing
Mm.
TMD pain in adults and you are preventing disfigured faces. And there's another topic that we're going to be covering in this podcast. And in my career, it's one thing I wish I would have learned, way back then on how to prevent the TMD. But it only can be done while that's your stick is telling us how that all works when as a child, how you can prevent the causes of TMD as an adult. But you're right. There is help out there, and you're right. People have to do a self-examination, not only of is it the joint, is it my muscles, is it my finances, is it my spouse, is
Right.
it my life situation? You
Mhm.
know, what is it, and where is there an answer? And the one thing that I'm very adamant about on finding a dentist is you've got to find one that you can trust. You got to
Right.
find one that you believe in. You got to find one that spends the time, that actually touches you and actually does a very thorough examination, not only historically, but emotionally, and the muscles and the joints and the teeth. That's the only way that you can know that you're getting help. And building that bond with the treating dentist is just absolutely imperative.
You know, um, it's hard. I'm sure our listeners can struggle with this. Like, I don't know what to look for. I don't know what kind of training. And, again, Mac and I are just trying to have an open discussion here, and be real. Our opinion, my advice is this is not for the oral surgeon. This is not for the medical doctors of any sort. We need to go through the checklists to make sure this is not something else. But if it's a true temporomandibular joint disorder issue, it has to be done with someone with a dental background
Right.
and training like us. And one of the most beautiful ways that when you look for a doctor, again, they have to have the right equipment. They have you now that you know a little bit about what your examination should be like, right? One of the ways that we treat patients is the first phase is doing some type of orthotic treatment. And that's a removable piece that you wear in the mouth on the lower jaw. And it's based off of, again, that 3D scan of muscles and understanding physiologic balance. So it's created to a balanced position that you get to wear. You get to test drive that in your mouth, and you'll know. You don't need us to tell you, or even the scientific objective data we'll take after to make sure you're responding well. But you'll know yourself, yes, oh my God, this is gone. This is gone, or this is better. This is finally what I've been looking for. And it's hard to have that leap of faith and trust that, oh my God, this little piece of, orthotic is going to take this pain away. You can try it. And before we do any braces or anything else to move the teeth into that position, you'll know it's your right decision. What is there to lose at this point?
So, as our colleague Ira Shapiro says, it is a diagnostic neuromuscular orthotic. What does he mean by that? When you put it in there and it's right, your headache goes away. That's the diagnosis. You just made the diagnosis that you had
Here.
TMD, signs and symptoms. And when they wear the appliance, you don't have the pain, the appliance don't have the problems. So you take the appliance out. When the dog eats the appliance, then all the
You're
all
tripping.
the headaches is, yeah, you've heard that story over and over again.
Oh, yeah, yeah, that happens.
Yeah.
So
And
what do
so
you think?
pardon?
What do you think? I think next podcast we need to get a little bit more clinical. Okay.
Yes.
I would love to dive into the craniofacial development. Like, why do I have TMD? Or why does my child look a certain way? Like, how does our face, what went wrong? What do you
What
think?
went wrong? I love that. I love that. What went wrong? That's really good. And it's nobody's fault. It's just, but you'll show them ways to overcome what might go wrong.
Exactly. All right.
All
So
right.
that's for today. We'll see you guys next time.
Looking forward to it. All right, Pam. Later.
Bye bye.